Hello, my name is Greg Stock, and I'm the CEO of Thibodaux Regional Health System. It's a pleasure today to introduce a new neurologist associated with our system, Dr. Tashfin Huq. What we're going to do is get him to introduce himself, tell him a little bit about where you were raised, your training, and then we'll talk a little more about what you're trained to do. How about that?
Sounds good. Thanks a lot, Greg. Thank you for inviting me here today, and thanks for allowing me to serve the people of Thibodaux and the surrounding areas. My name is Tashfin Huq. I'm a neurologist by training. I was born abroad, came to the US at the age of 18 for college when I went to Princeton University for my undergrad. Then fell in love with a girl who's thankfully my wife right now. She's from New Orleans, southern lady. That's why came down to the south, fell in love with New Orleans, then went to Tulane for medical school and also did my neurology residency there. Then I went up to the north again, went to New York City, did my stroke fellowship at Cornell University up in New York City. I really enjoy treating all kinds of neurology patients, both general. I do specialize in stroke. I have a special interest in epilepsy, seizure disorder, headaches, and migraine disorder. But I do treat both general and subspecialty neurology patients.
And having that stroke fellowship there at Cornell, which is your education is fabulous, really suits the need well for our region. Frankly, there's just not a lot of stroke care in the area in terms of your type of training. And so we sort of double welcome you there. Thibodaux Regional, we're trying to live up to being a regional hospital. And we think that's in that bucket. And of course, because these people are friends of yours, that there's 4 more neurologists that are joining our staff. There's 3 of you now, and another one in December, and another one next summer. But talk just a little bit about stroke, Dr. Huq, and what you feel we're going to be able to do to help people.
Definitely. So we are actually part of the stroke belt here in the southeast, and then Louisiana, and particularly Thibodaux and Houma and Raceland and the surrounding areas. We fall very much in the stroke belt, so as to say. We have a lot to accomplish here. Even though the stroke mortality has gone down, but the disability that people encounter after suffering from stroke is quite severe. The comorbidities are going up. We have, as our population is aging, we have diseases like hypertension, hyperlipidemia, diabetes, atrial fibrillation. So we are to the point that here at Thibodaux now, we are actually treating almost all kinds of strokes, both hemorrhagic and ischemic. So, and then we are actually trying to get better and better and trying to do more and more with our resources. As you mentioned, some of my other friends have already joined in neurology department. Others are also coming. So we will be able to provide them with a comprehensive neurological care.
Very good. We have a neurosurgeon join us, who you know, a young woman that was raised down the bayou, went to Nichols and went on from there. She'll join us next summer. Dr. Huq, it's really great to have you here again. We
Pleasure.
Appreciate it.
Thank you so much.
And thank you for coming on our little program today to do an introduction.
Thank you. I appreciate it.